Muy buenos días, muy buenas tardes. Desde la Organización
Good morning
Panamericana
and good evening from the Pan American Health Organization regional office
les damos una cordial
from the World Health Organization to the Americas. We warmly welcome
tan
you
relevante para
to
todos
such
nosotros
relevant event for
de
public
las
health
Américas.
throughout the
Para
Americas
mí
region.
es un día muy
It
importante
is
que
really
nos
a very
acompaña
important day
y este webinario que se
for
denomina
with this
Las
campaign
manos
and this webinar
salvan
entitled
vidas.
Hand
Quiero
Hygiene
hacer
Saves
unas
Lives,
palabras
sharing
de
innovative
manos
experiences
salvan
for
vidas
hand
de la
hygiene
salud en las
during
Américas.
healthcare
Y fíjense que
provision in the
estamos
Americas.
compartiendo
And note
experiencias
that the
innovadoras
topic is
y es
sharing innovative
esta
experiences. And
semana
in this
también Día
manner, we
Mundial
can
de
echo
la
the
Salud,
world campaign
Mundial
from
de la
the
Salud.
World Health
Y
Organization,
se trata de preguntarnos por
which
qué compartir
intends to
información,
pose to us the
conocimiento
question,
es importante.
why sharing information and knowledge is
Para
important?
ayudar a
And it is
combatir
important
estas
to
patologías,
help
estos
put a
microorganismos
stop to these
multiresistentes
pathogens
en
and
la atención
microorganisms that are
primaria.
multi-resistant
De manera
in
que estamos
provision in the
poniendo en
provision of
práctica
healthcare.
compartir
In this way, we are putting to practice the
experiencias
sharing of
y
information and
puedo
innovative experiences.
compartirles
And
mi
when we
visión
discuss
y
sharing,
para que
this is two
nos
ways, goes two ways.
animemos a participar
So
en las diferentes
we encourage
cuestionarios,
you to
en el chat,
participate
en las
in the
preguntas
many
y en los
quizzes via the
comentarios.
chat and
Antes de
also during the
comenzar,
Q&A.
unas cortas
Before beginning,
instrucciones.
some
Mi nombre
brief
es Pilar
instructions.
Ramón Pardo, yo
My name
soy
is
la
Pilar Ramon Pardo.
coordinadora del programa de
I'm
resistencia
coordinator for
frente a
the
los
special program
antimicrobianos en la Organización
for resistance
Panamericana de la
to
Salud.
microbes
Verán que
in the Pan American Health
se traducen
Organization.
a diferentes
You will note
lenguas.
that there
Pueden
is
elegir
interpretation
cualquiera
into
de
different
ellas
languages. You may
pulsando el
select the one
botón
of
inferior
your
derecho.
convenience in the lower part of your
Les
screen.
solicitamos que mantengan cámaras y
We request that
micrófonos
you keep
apagadas,
your cameras and
de manera que
microphones
disfruten
off,
y que
but
puedan
still we encourage you
participar
to
en nuestras
participate
preguntas y respuestas
via
y diferentes
the Q&A
oportunidades que van
section
a tener
and
durante
at
el
different
webinar.
times where you'll have the
Sin más,
opportunity during the
damos ahora
webinar.
paso al
Without further
vídeo
ado, we will
del
now give
doctor
way
Jarbas
to a
Barbosa.
video from Dr.
Él es el
Jarbas
director de
Barbosa
la
Jr., who's
Organización Panamericana de la
director
Salud, que
to
nos
the Pan American
dirige
Health
unas
Organization,
breves
will
palabras
provide us
de
some
bienvenida.
welcoming
Adelante con
words.
el video,
Go
compañeros.
ahead with the video, colleagues. Thank you.
Mundial de la Higiene de las Manos, la Organización Panamericana de la Salud, OPS, se une a esa celebración para reafirmar la importancia de la higiene de las manos para prevenir infecciones, muertes, discapacidad y la propagación de organismos resistentes a los antimicrobianos. Es importante difundir conhecimentos e experiências sobre a higiene de las manos porque ajuda a evitar
It
la
is important to disseminate knowledge and experience on hand washing because it avoids the spread of dangerous pathogens, including
including
in
in a
healthcare
health center.
facilities.
Lack of hygiene
Hand
in
washing
hands may
or
cause
lack thereof
infections,
may
and if
cause
this
an
happens
infection, and if this happens during the
during
provision
the
of healthcare
provision
services,
of health
these
services,
infections
this
can
could
lead
create
to serious consequences
consequences
for
in hospitalized people,
in-hospital patients, and
mainly
particularly if
if
microorganisms are resistant
organisms are
to
resistant to microbials, which make
antimicrobians, it will
harder.
complicate further treatment. Hand washing can
Hand
save lives
hygiene may save
when it is
lives.
applied in adequate moments in the provision of healthcare services. This is why it's crucial for every individual, and in particular healthcare workers. They should know when and how to perform this. Also, hand washing is a very effective way to protect oneself before serious infections. In the Americas region, there are still disparities in coverage and quality of healthcare services. This especially affects low-income populations and also those in a situation of vulnerability and rural communities. It is highly important for all primary and in-hospital units to have safe and accessible water, clean sanitation facilities also for hand washing at the points of service provision, and adequate systems for removal of waste. Also, we need to invest more in training and hand washing and also prevention and control of disease, and also to make the population aware, and also human resources and healthcare on the importance of this matter, so that we build a culture of safety and quality in healthcare provision, where hand hygiene is an absolute priority. It save lives. Wash your hands. Thank you for these inspiring words from the director of the Pan American Health Organization. We would like to carry on with our agenda, but before we would like to acknowledge those countries that are with us in this webinar, and also to those from the Americas region. We are also welcoming countries from Asia, Africa, and Europe that are joining this event. We will now give way or hand the floor to Dr. Blanca Peñalosa, who's a consultant in healthcare systems and services quality, also here at the Pan American Health Organization. Go ahead, Blanca, you have the floor. Thank you so much, Pilar, and good morning, everyone. Welcome to this new annual encounter. On an annual basis, we stop our activities to celebrate this Hand Hygiene World Day to incentivize and learn on how to learn among all of us on how to improve on this hygiene, which will allow us to, as our director was saying, it will allow us to save lives. We had a period or a time when we learned very intensively or very hardly during the pandemic about hand washing and its importance, how this became mainstream throughout our territories and in all of our contexts. But now 2 years have passed, or a couple of years have passed, and it is now necessary to share certain experiences that allow us to reinforce on this training regarding hand washing. And this is the central motif or reason for this activity today, which would be sharing experiences that will be told by the teams in our region who have developed innovations and who will be able to tell in detail what these new ideas entailed, these ideas that may serve as inspiration and motivation to all of us listening here. So to kick off and as a as an icebreaker, we would like to invite you to an activity that we can do by using a tool that Zoom includes. And since we now have enough people on the call, we would like to know more on who we have here. So we will make use of a Zoom tool which allows us to perform a brief online survey. So I will now share a questionnaire with you that will show up on the screen. And for those who are following us via their cell phone, this is just 5 questions. The idea is for us to share a bit on who we are and what we know regarding hand hygiene. So whoever answers via their cell phone, you don't need to switch screens because what we're told is that the survey will close if you do so. So I will now share this questionnaire with you. Save lives, wash your hands. It's only 5 questions, and we'll begin with some that will allow us to describe who we are. So I invite you to participate from the survey. The first question is, could you tell us what is your age range? Here, the idea is for us to set where we are. Those who are younger would be option A, less than 25. For those between 25 and 40 is option B. For those between 41 and 55 is option C. And those with the most experience, they will have the option for more than 55 years. And I can now see that 75 people are now answering, and we're approaching 100. I will later show the results, but for now, the age range between 25 and 40 years is prevailing. So I invite you to continue participating or answering so we know who we are, those of us who are here. Just a couple more seconds. We have an intense participation. We're almost at 50% of participants. We have that 50% of them are between 25 and 40 years of age, so there's a young audience here. Numbers are still growing, reaching 300 answers by now.
Voy a avanzar a la pregunta número 2. Entonces, la pregunta número 2 es,
Now moving on to question 2, which is, what is your profession or title? So option B is nurse, or for other healthcare professionals, many perhaps staff and also students in the area of healthcare. They can also make use of this activity to learn more on the matter. And we also hope there are people who are not healthcare professionals in our audience, who perhaps we have groups of patients or other professionals or groups of interest who are participating. We are now just over 300 answers, and most participants
Muy bien. Muy bien, voy a pasar a la pregunta 3.
very good. I'm now moving on to question 3. The place where you work or you study, hospital or clinic, healthcare center or primary healthcare center, another healthcare facility, or the last option is for those who do not work at a healthcare facility. People are now answering very quickly. Most are answering that they work at a hospital or a clinic, more than 200 of them, most of those of us here. Now moving on to questions related to hand hygiene. When was the last time that you received training in hand hygiene? And perhaps someone can remember in the last year, that would be option A, or between 1 and 5 years, that's option B. And someone might remember that very long ago, more than 5 years, they received training. They can also select that option and see, or perhaps there's some who have never received training in hand washing. And lastly, moving on to the last question, which is a more specific one regarding the 5 moments of hand hygiene and which relates to our practice, whether this is practice habitually, if you only practice moments 1 and 5, if they is unfeasible to put them into practice, or if there's anyone who does not know about the 5 moments. We will give a few more minutes for answers to come in. And remembering that the 5 moments are washing hands before touching the patient, before performing a task. It should be septic. And then there's the risk of exposure to liquids or fluids, and then after touching the patient. And then the 5th point is after contact with the patient's surroundings. I will now give a few more seconds. There are still people answering. We have more than 400 answers. There are still some who are still answering. I will now give 10 more seconds before closing the survey and sharing with you the results. There's still some answering with much enthusiasm. We have now more than 400 answers. Remember, we're asking about our own personal features, our age, our occupation, where we work, our workplace, and a couple of questions related to what we know and how we put into practice hand hygiene. Now I will close with 424 answers. I will now count to 5. 1, 2, 3, 4, and 5. I still see the numbers moving, which is why I'm not closing. Now I will. It seems no one else is answering. And I will now share you the results on who we are. And note here for question number 1, we had 432 people who participated. And if you see 42% are people between 25 and 40 years of age, 37% between 41 and 55, and those less than 25 and over 55 for the smaller groups with 9 and 12%. So we have a group of people who in general are young, but tending to have experience. Now, regarding our profession or title, out of the respondents here, we also have 432 answers. There's 10% of physicians by far. Nurses, midwives are winning at 53% of our audience, which personally is no surprise to me, as nurses and midwives have been those who have led the standard in promoting proper hand washing in general in healthcare facilities. There's 18% of people who are other healthcare professionals. Nursing assistants also at 4%. We have students at 8%. We're glad to know about that. And 7% of non-healthcare professionals. What is your workplace? Most are working at hospital or clinic, more than 60%. Then come other healthcare facilities at 15%, and also 15% are not working in healthcare facilities, and only 7% works at a primary center. So here's our opportunity to increase our share for healthcare workers. When was the last time that you received training? Almost 70% of those here has been less than a year, which is very good news. 20% in the last 5 years, and a very low percentage have never been trained, or they have received training more than 5 years ago. And last, regarding the 5 moments of hand hygiene, over 80% of those here practice this habitually, so congratulations to everyone. There's a percentage of people saying that they only put into practice moments 1 and 5 at 13%, and very few people are saying it is impractical. And 5% did not know about the 5 moments, so if I can provide a remote round of applause to your participation. We are very thankful for your engagement and for having answered. We now have it more clear regarding those here. We can now say that we have our hat well in place regarding hand hygiene. Having said that, I would like to thank you all for your participation. I would now like for us to begin sharing experience, which is what calls us here today. It is on me to present to you Mr. Alvin Hart, who's a nurse and officer for prevention and disease control, responsible for geriatric facilities for long-term care within the Ministry of Healthcare and Welfare in Barbados. Mr. Hart has also been a consultant in prevention and control of disease in the World Health Organization, where he worked in Sierra Leone, West Africa during the outbreak of Ebola, and he has also served as national manager of quarantine facilities for public and private facilities during the COVID-19 pandemic. The experience he'll be sharing is the Train the Trainers, a guide of best environmental hygiene practices for prevention and control of disease in healthcare facilities. This work that he'll be sharing about is a product of a joint effort between the Ministry of Health and Welfare Barbados and Pan American Health Organization offices at the country and regional levels. We now invite Mr. Hart to share his video and to tell us about his experience. Go ahead.
Good morning and thank you. I'm just waiting for the video to be loaded.
Sí, muchas gracias. Estamos esperando entonces el video.
Yes, thank you so much. We are now waiting for the video. Please to our colleagues.
On November the 15th to 17th, 2023, the Barbados Ministry of Health and Wellness and the Pan American Health Organization implemented a training program designed to prepare 65 hospital clinical support staff from 7 facilities across the island to teach key hand washing, environmental health, and infection prevention and control principles to their colleagues. There were 3 innovative ideas in this training. IPC training designed specifically to non-clinical staff. This training mainly focused on persons working in housekeeping, environmental health, recreational therapy, dirty laundry, and other departments shown in this video. This cadre of staff move, touch, communicate, and interact with patients and their belongings in every hospital every day. Despite being the first line of defense against HAI and AMR in hospitals, these colleagues rarely receive any IPC training to support their jobs. The training content specifically designed to share knowledge, promote access, raise awareness, and encourage evaluation about IPC allow Barbados to include this experienced and dedicated group of staff. Flipping the classroom, after 1 full day of instructions and 6 core IPC modules, the participants were divided into 6 groups and asked to develop presentation on 6 of the training modules they were assigned. While these presentations had to be accurate, they were free to choose any teaching modality they wished. Groups used skits, role play, PowerPoints, presentations, and first-person demonstrations. Flipping the classroom, participants responded to the teaching challenge with more thoughtful questions, a deeper understanding of the enhanced engagement with the material. Number 3, using of electronic tools and communication. This was a completely paperless meeting with all materials, handout, references, presentation slides, and support material made available to participants in SharePoint. Participants completely pre and post tests for each module and also provide anonymous feedback to the course using Mentimeter software available via QR code scanned by their mobile phones. This allowed participants to give direct, honest, anonymous feedback and led to excellent review and participant rating of this course. This course improved capacity in essential infection prevention and control in several cadre of healthcare workers. Thank you.
Muchísimas gracias, señor Hart, por su...
Thank you so much, Mr. Hart, for your presentation and for sharing this interesting experience, which merged the richness of in-person activities with the utilization of technological tools, which improves learning and the commitment of participants. I would like that in just a few minutes, if you could go deeper on the goal of this training and what you consider that has been the main achievements of this effort that was held in Barbados.
Okay, thank you. The major objective of this training was to improve prevention and control knowledge, including hand hygiene, use of personal protective equipment, and environmental cleaning principles among non-clinical staff, to develop a group of non-clinical staff to lead the coaching of IPC techniques with their departmental colleagues, and to identify IPC-linked persons or champions in non-traditional departments and healthcare facilities. The main achievement of this training was the participants' demonstration of mastery of essential IPC techniques during this training. This was demonstrated through group presentation, in-depth discussions on the various IPC topics, solid demonstration of practical techniques like donning and doffing of PPE, and effective environmental cleaning techniques and hand washing. Effective linking of their prior experience with the COVID-19 pandemic to IPC knowledge and improved scores and post-test evaluation. For example, hand hygiene opportunities versus actions. Persons also started discussion on how they can improve IPC standards within their departments and the next step to improving IPC within their job functions. Thank you.
Muchísimas gracias. Será muy interesante si
this knowledge and how they can also act or serve as agents of change in their working environments. So we would like to know how this goes later. And regarding the continuity of these learning opportunities, thank you so much. I would now like to hand the floor back to Pilar, who will present to us the following experience that will be shared this morning. Go ahead, Pilar. Thank you so much, Blanca, and excellent. The experience from Barbados.
Thank you very much,
We
Blanca.
thank you for that sharing. We will
Thanks
now
for
move on to our
the
next presenter.
presentation.
Note that it is true that nursing professionals have commitment and leadership.
Tengo el gusto de presentarles a María Teresa Contreras Palma. Ella es enfermera especialista en epidemiología y actualmente se desempeña como enfermera especialista del Departamento de Enfermedades Infecciosas en Colsanitas Clínicas Reina Sofía. María Teresa tiene una amplia experiencia en la prevención y control de
Maria
infecciones.
Teresa has broad experience in the prevention and control of disease and
Desde Colombia.
the
Maria
safety of the
Teresa
patient, and
has wide
comes from
experience
Colombia. The
from
title
Colombia.
of
The
her
title of
experience is
experience
Multimodal Strategy for Hand Hygiene
multimodal experience
in
in the
the
Reina
Reina
Sofia
Sofia
clinics in
Colombia. Go
Colombia
ahead.
in regards of hand hygiene. We're going to turn it over to Maria Teresa Contreras Palma. Over to you, Maria Teresa, please. Good morning, everybody. We're going to show a video, and we're going to share with you a message about what we have been done from our department to adopt innovative strategies and capture the importance of all this for patient security across our population, not only among health workers, but particularly among our patients, for our patients who are the most important person that we work for in preventing infections. In the Reina Sofia clinic, the hand wash strategy is critical for infections control. We carry out a strategy including the day of induction with 1,421 workers and 128 patients using playful and strategies. We trained hidden observers to assure and we assure time for workshops and simulations and the observation of observers, and we analyze the quality of the tool for gathering data and providing real-time information to correct deviations. Approximately every month we had these game games, and the workers were leaders in the health modes for adapting it to demonstrations in movie theater settings. This strategy resulted in the increase in pertinent data that have permitted to reduce the infections rate. We distributed incentives to the personnel who adhere best to hand wash, and also to observers, including free days. In conclusions, the reduction of infections has due to hand washing has been effective in work together with the management and processes departments, and we have thereby improved the quality of our health provision for patients and their relatives. Thank you very much, Maria Teresa, for this outstanding video. And if you will allow me to, I would like to ask her follow-up questions and to get more detail about your experience. What is or what would be the need or problem that you identified that led you to conduct this training, and closely related to that, what the indicators you are measuring that you're using to measure the impact of your training? These are the two questions that we would like you to address. Over to you, Maria Teresa. Yes, of course. Post-pandemic, we had very high indicators, up to 90% in compliance in hand washing. And after the pandemic, we realized there was a very significant drop. And then we started to assess what were the sources and the causes for this reduction. And we found that there was a lot of lack of knowledge and the lack of the capacity to recognize the risk. There was, so to speak, no further scare. And so we started to identify the risks that would contribute to these higher infection rates. So together with we carried out a process evaluation and a plan a strategy so that the staff would be aware of their risks and recreate this patient safety culture. We created process leaders and observers that allowed it to check not only infections but also the services by each cabinet. And we prepared two very strong indicators, that's the quality indicators and the data quality, and that allowed us to verify by time and by position. This means that we evaluated the observers so that they could meet the indicator objectives properly, and this indicator would show us whether they were performing correctly. One of the objectives in evaluating this personnel is that the general services personnel do not perform the second stage in the hand cleaning stage. And then we realized through the observers that this was data was not correct. This transition took about 6 months. The first indicator gave us like a 30-40% rate, but after the training that lasted 6 months, the fulfillment capacity had reached 98%. That's quite impressive. Those results are quite impressive, and also it's outstanding the way to measure the impact of the intervention that is oftentimes a challenge, and also incorporating various observers and actors to participate in implementing the strategy and increase hand washing practices, which is the practice of which is a challenge over time. And then we're now going to listen to our last presentation, and I'm going to turn it over to Milena Corridor. She is an international consultant in a very relevant department of the Pan American Health Organization. That's the Health Emergencies Department. Over to you, Milena, and please continue with the panel. Yes, thank you very much. Thank you, Doctor, and thanks for the invitation. This is certainly a very valuable experience, and I'm pleased to be with you today. And I'm now going to turn it to Engineer Andres, since he is an expert in strengthening emergency health teams. And he is a consultant with this department at the Pan American Health Organization. He has very valuable experience in a number of very complex scenarios, and he's going to share with us the experience in hand hygiene in mobile hospitals that have been deployed in the disaster areas. The team that he leads is the team of mobile health teams. Thank you very much, Milena. I would like to start sharing with you a video on hand washing experiences in emergency medical teams. Let's watch the video now. If it could be shared. The easiest, the most simple and cost-effective way of preventing infections. It also helps to fight antimicrobial resistance, which is a very important public health issue. In our hospital, that's EMT hospital number 2, we have a very low rate of surgical infections, and this is thanks to the hand washing practices. The COVID-19 left with us a very important teachings, not only on the negative side, but also on the side that is hand washing, because it helped us prepare in a more conscientious way and more frequent way to wash our hands. At the mobile hospital number 2, we are based in our multi-model hand washing strategy that has a number of guidelines. In the first place, to strengthen the health personnel in effective practices focused on patient safety. At the hospital, we have a strategy to strengthen and the hospital staff permanently in hand washing, and we carry out evaluations to determine what is the final outcome of the knowledge that has been taught. We must remember that using hand wash in patient care increases the patient's security and ourselves. So clean hands save lives. Thank you very much. That's a great presentation, and I would like to ask you, engineer, if you could comment on the importance and the results of hand wash strategies in emergency hospitals. And as we said earlier, hand washing protects patients and health staff. I think everybody's clear about that, but also for other medical emergency medical teams, the multiple barriers in these EMTs in their deployment and operation, not only for patient health, but also in interactions between areas, personnel between areas, and the latrines and kitchens prevent the spread of these infection vectors. Hand washing and other infection control and prevention have made the intervention of these medical emergency teams to be safer and more effective for personnel and patients. And this happens precisely at times when it's more difficult to operate because a lack of water and increased risk of infection increases the potential for the spread of these issues. And could you perhaps share with us examples of how the hand wash strategy is included in and how this has contributed directly to reduce the issues related to infection in regards of water issues. We have to determine the location and the obligation to wash hands at the appropriate facilities, but also the self-sufficiency standard that provides continuity to these good practices that depends on the local authorities' abilities and capacities to uh, respond to these situations. I don't want to give you specific examples, but since 2010, with the standardization of these medical teams, we now have in them sufficient water, quality water, and resources, and alcohol, gel, and soap for staff, and that contributes to improving the hand wash practices in these facilities. Thank you very much, engineer, for your response and the presentation. I think this is an example of how to connect the different agents that are involved in these very important practices. And thank you very much for your time. Thank you very much, Milena. Thanks very much, Andres, for your outstanding presentation of this experience in such a different context. We've had the opportunity this morning to learn about these three experiences. There are certainly many more. If we could listen to the people in the audience, certainly they would come up with many other innovative experiences. We have learned this morning a little bit more in depth about these are three very different conditions and experiences and innovative experiences in a hand wash training. We would take advantage of these last minutes that were left to open a debate with our speakers this morning to delve into what they have shared with us. And I would like to welcome again Mr. Hart from Barbados, Maria Teresa Contreras, and her team from the Reina Sofia Clinic in Colombia, and Mr. Anderson for the medical emergency medical teams to join us. And perhaps you could comment one at a time on your share your thoughts on how to move forward. What would be the next steps that you consider could help us to provide a sustainability and continuity to these types of strategies that you have shared with us? Perhaps if you could share your insights in this regard. Let's start with Mr. Hart for his thoughts. Could you perhaps share your thoughts in this regard? Thank you.
Okay, thank you very much. Today, hand hygiene still remains the most cost-effective method in reducing the spread of infections in healthcare facilities. Decision makers must do the following. They must assign adequate and consistent budgets for IPC supplies, including required materials for effective hand washing and hand rubbing to avoid stockouts, and a coherent governance structure that can set policy, objectives, strategies, and legal and scientific basis for the prevention and control of hospital infections. 2, results from hand hygiene audits must be used as data for action and not pushed under the table. To improve hand hygiene compliance, through other multi-module approach to training, improved facility infrastructure, provision of high quality of hand hygiene products, and consistent monitoring of all the factors that can improve hand hygiene compliance. And three, strengthen and create IPC units or departments in all facilities with qualified, dedicated staff with defined responsibilities and duties and a budget sufficient to meet the task program and their work plans. Thank you.
Muchísimas gracias, señor Hart, por compartir su
Thanks
reflexión.
very much, Mr. Hart, for sharing your thoughts on this issue. Now I'd like to turn it over to Maria Teresa for her thoughts.
¿Me escucha?
Una reflexión muy importante que nos dio
An important thought about the experience after the pandemic is that we have to work as a team. We have realized that we are stronger when management, the process leaders, the administrative staff cooperate towards a single objective. Once we talk about infection control and patient security and safety, we must talk about our behavior as persons and health staff that will allow us to change the culture among our workers. Infection prevention is critical, and the number one strategy is hand hygiene because that helps to minimize everything. It helps us reduce infections and the causes of infections that is not necessarily intentional, but which happen. And when we engage in this control, we can change our patients, our clinics, our establishments, and obviously ourselves as human beings. It is through all this that we can create these changes and persist, which is paramount because everybody has these ideas and concepts that want to and continue to work on infection control, but without the support of a management and our leaders and our patients themselves that will help push us forward, we really cannot accomplish a change. But with this teamwork that provides a very solid foundation for where we can persist, and that is fundamental to persist because that allows us to adopt very important changes, and we're doing that now. We are very proud now to have certain accreditations and certifications that help us to keep working with our patients through teamwork. And it's critical to have our patients involved because with their support, we will always be able to save lives. Thanks a lot, Maria Teresa, for those stations. Those are very motivating words for all those of us who are listening to you. And as we're Mr. Hart's ideas of involving all the players and decision makers and teams and health teams and patients to sustain and persist over time to keep proper levels of proper hand wash and hand hygiene. Now I'd like to turn it over to Andres. Perhaps you could share your thoughts about the challenges, the sustainability challenges for these efforts in such a different and difficult context as you have been working in regards of hand hygiene. Yes, my thoughts or my message is that you should look at the initiatives at the emergency medical teams to take it as a reference or an example because hand hygiene is something that is done in emergency situations, and logically it can also be done in non-emergency situations. And we have to create awareness among our emergency teams by standardizing hand hygiene. Hand hygiene is not just a good idea, it is got to be a mandatory approved requirement regardless of the type of health facility, whether rural, mobile, or permanent. If there is no a consistent approach to do this in training and research provision and the enforcement of these practices. Let us remember that clean hands save lives. Yes, thank you very much, Andres. That is very relevant because in a health emergency care, the needs of sustaining over time is highlighted and clear to everybody. And so using this approach at the EMT hospitals as a model is definitely a very valuable message. We are approaching the end of our activity, and I want to thank the enormous contribution from all those who have shared their experiences with us. I think they have been extremely valuable and enriching, but I would not like to forget the need also to underscore training in hand hygiene in schools and universities that are training health professionals. There is a number of students in this audience that we must not forget, and also to take this message to the people, have an influence or capacity to create the study curriculum programs, and so that they can have influence on the theory and the practice of appropriate hand hygiene. Now I would like to turn it over without further ado to Pilar Ramon Pardet to close this valuable and very uh, interesting experience this morning. Thank you very much, Blanca. And I want, with all the participants in this event, we have had a very enriching experience to learn firsthand these experience, and thank them for their generosity to share with us their experiences and their accomplishments. I would like to underscore that we are now going through a global world campaign where we have also the sponsorship of the World Health Organizations, and in these days across the world until May 5th, there will be several webinars and seminars in their own countries and health establishments.
Todos los días con la higiene de las manos que salva vidas.
And I encourage you to participate in these activities that help lives, contribute your innovative solutions, and work on adherence and monitoring and measuring your accomplishments. And this reminds me one of the most relevant topics that are going to be discussed at the World Health meeting conference in just a few weeks at the World Health Assembly meeting in Geneva. The World Health Organization will sharing the plan of action, the monitoring framework for the infection and prevention and control programs, and that includes a very important chapter on hand hygiene, and also about indicators to monitor world progress towards the accomplishing these indicators to make hand hygiene, to have it as the most frequent practice in the health establishments. We encourage you to be aware of the developments of and the activities in all countries across the world that relate to infection prevention and hand hygiene. There are many questions in our chat box, and also in the questions and answer sections. And now we would like to call your attention to the chat, where there is a link where you can at the end of the day to look at the event that we have just participated in, and commented and shared with your colleagues to contribute to its wider dissemination. So please look at the chat, where today at the end of the day we will be publishing the recording of this event. And without further ado, we want to very welcome Thank you for participating in this activity to share the experience and these experiences that we are certainly that you carry out in your own health establishments and hospitals, always in the search for improved quality of care for our patients. Have a great day, and let's keep working together to improve hand hygiene worldwide. Thank you very much. And now, please turn on your cameras to the team, the speakers, and the team that have supported this event, a multidisciplinary team, and also our thanks to our interpreters that allow for communicated in all different languages. And and to all those of you who have set aside some time and for your attention to this program. Thank you very much, and we wish you a lot of success in your work.